Questions I'd have for Violet's hand surgeon before developing her treatment plan is what tendons specifically were damaged and were they complete laceration partial, were there any signs of potential nerve injury, and how long is the risk of drilling the cast to be continued. I'd get these answers from the physician by either emailing the physician or contacting the office via phone and fax. Violet's strengths are that her dominant hand is uninjured and thus allows for greater independence. This allows her to be able to complete ADL and IDL tasks that require two hands easier by using the left hand to kind of compensate for the right. Violet has no other limitations such as cognitive deficits aside from her depression or perceptual limitations which allows her to complete therapy. And Violet lives with her family who can help support her in her recovery and keep her in on her home programs. The hand surgeon orders active wrist flexion with those plan in addition to the present protocol. This changed my treatment plan. I'd add in home program exercises to engage in wrist flexion and have Violet participate in wrist flexion activities in the clinic, such as flexing the wrist to pick up objects from the table with her right hand. Specific precautions she should follow to protect the tendon repair include avoiding heavy lifting, avoid repetitive hand movements, avoid awkward postures that places stress on the wrist for an extended period of time. What could happen if she does not follow these precautions? The flexor tendons could rupture and she could re-injure herself. What other issues might develop if she does not follow her exercise protocols? If she does not follow these protocols, she could suffer from edema, contractures, or decreased range of motion, which would limit functional use of her right hand. How could I reinforce Violet's adherence to precautions? I had explained to her the dangers of not following the precautions and explained that she is not to use her right hand for anything other than her exercises. How would I address the absence of Violet's work role? I try to incorporate work activities into the therapy process when strengthening and return to work activities can begin. Violet tells me her father wants to come back to work right away. She asks if I can explain the situation to him. I discussed with him that Violet should not return to work for at least 6 to 8 weeks, otherwise she risks rupturing her tendons and requires another surgery, resetting all the progress she's made. I do not believe that she is physically capable to return to work at this moment, as she has not yet healed enough to even begin light activities. The tendons or disconnected tissues will not have time to heal. Emotionally, I do not believe Violet is ready to return to work as she is presenting with symptoms of depression and is lacking in attention and recall abilities. If Violet was to return to work, what type of accommodations would need to be made for her? I think she would need to have the ability to perform all tasks with only her left hand. She would be unable to move boxes or other activities that require two hands and would need assistance in performing those. I'd explain Violet how to care for a dorsal blocking splint by telling her to avoid extremely hot areas as the splint can alter its form when heated up due to the material. The splint should also be kept dry by being covered with a bag during showers. At this point, I would not begin working on strengthening as the tendons are disconnected tissue and thus not enough time to begin strengthening activities. This takes about 4 to 6 weeks. I'd have a home exercise program for her. I'd have her continue to follow the recommendations provided by the hand therapist for her hand. I'd add in further range of motion activities for her digits and wrist, as well as elbow and shoulder range of motion activities to help prevent stiffness and possible weakening of those muscles due to non-use of the right hand. Explain treatment techniques related to scar management. I'd use scar mobilization techniques as well as elastomer to manage scar appearance and density. Related to edema management, I'd have Violet elevate her right arm above her heart level when she's sleeping. I'd have her use compression, as well as keep up her active range of motion exercises to remain mobile, as remain mobile will help push that excess fluid out of the hand. How might I incorporate treatment of her decreased attention span and recall into my hand therapy sessions? I could provide memory tasks for Violet while performing exercises, such as asking her questions about something I had told her before that specific exercise had began. How might this injury affect her relationship with her parents? It will most likely strain her relationship with her parents, as they are deeply religious and Catholicism generally looks down upon suicide. Her inability to work will also strain her relationship with her father, who places great influence on her working. This relationship with her parents, her progress may be slowed if the relationship deteriorates due to her emotional state worsening and lessening her motivation to improve. It might also affect her relationship with her fiance and cause it to worsen due to again Jewish religion looking down upon suicide. Also, her attempt at suicide might make her boyfriend/fiance feel guilty for it. What impact will this have on progress? If the fiance is unsupportive due to a strained relationship, then it may cause a lack of motivation to improve in therapy. Do I feel is it appropriate to address her depression in outpatient OT? No, I do not, due to her being on antidepressants and receiving outpatient psychiatrist treatment 3 times a week. I am entering into another profession specialty that she is already receiving, and that's not my job as an OT. Violet's father accompanies her to one of her OT sessions. He stands up and demands I explain to him why she is not allowed to return to work. I explain that she is to return to work at this moment. She is rupturing her tendons again, which would require another surgery and set back all the progress she has made so far. The father starts blaming me for her slow progress. His voice is whispering and she begins to cry. I politely ask her father to step outside of the room if he will continue to escalate his voice, and I will speak for him when he has regained some of his composure outside and away from Violet. I prevent this from happening again by either not allowing her father to come into the OT session or by discussing these issues with him privately with Violet not in the room. I'd educate Violet's family about her injury and recovery process by providing brochures and online sources where they can see the steps to recovery and how Violet has to be careful during the recovery phase and the steps she must take to ensure that she heals effectively and safely for the tendons. Violet's doctor now tells her she is allowed active digit flexion from the splint. This changes the treatment plan and goals by allowing her to incorporate active range of motion goals and exercises that she can now begin playing at home for her digits. Violet is minimally compliant with her exercises and home programs, but not SP. I believe it is due to her depression, which is leading to a lack of motivation. How could I help improve or follow through with her home program? I could help her improve or follow through by discussing the importance of recruiting the help of her family or fiance to help ensure she commits and follows the program. Violet has canceled the last 2 OT sessions. What do? I'd reach out and encourage Violet that she should return to the OT sessions in order to continue her treatment, or her goals would not be able to be met without the therapy. Violet's PIP contraction proves very low. What would my course of action be? I'd place greater emphasis on the treatment of her contractions and implement more exercise targeting the range of motion of the PIP joint, as well as explain how she has not come to therapy and do her home exercises that will never improve. Violet's progress is at plateau. However, when begins to get discharge, she promises to work harder. I'd explain to her that the fact that her progress has plateaued and her inability to follow through with her exercises and home programs, despite my repeated warnings and considerations, means that there's nothing I as a therapist am able to do if she is unable to work on her recovery process. What would my feelings be regarding discharge from therapy? I'd be disappointed that she's unable to meet her goals, but I'd also understand that as a therapist I had done all that I could, but I cannot force a client to complete her home program exercises. Looking at the intervention, 2 major problems for the client is the deficit in her right hand impacts her ability to perform IADLs that require the use of both hands, such as driving and working, and clients' decreased attention span, lack of motivation, and inability to focus limits her participation in therapy, which decreases the possibility for regaining full functional use of her hand. These problems are priority because the inability to use the right hand limits independence, especially in regards to community mobility. Client also demonstrated concern that she would look like a freak if she is unable to regain use of her right hand, which could lead to the worsening of her mental state and depression. Addressing her attention span and motivation are crucial in order for the client to be compliant with home programs and participate fully in the therapeutic process. Looking at long-term goals, client will independently drive her vehicle from the clinic to her home with no verbal cues by discharge. The client will independently answer 15 questions given throughout the therapy session with no verbal cues by discharge to demonstrate short-term memory, attention, and attention. Looking at short-term goals, client will address self using both hands independently with less than 3 verbal cues by the 5th session. Client will demonstrate home program exercises independently with less than a 10-second delay before initiation in 2 weeks. Looking at the intervention-specific IDs, the first one is the occupation-based intervention, where a client will have a shirt and pair of pants placed in front of her that she will don and doff using both hands. The second type is a client program type, where I'd have the client use her right hand to select flashcards with proper home program information to demonstrate understanding of the home program exercises. By having the client engage in an ADL that is best accomplished with 2 hands, such as dressing in this case, the client is able to work on developing coordination and strength in her right hand again. And then by selecting home program information, the client is working on her recall abilities, as well as right hand fine motor dexterity by picking up the flashcards. To upgrade the first task, I would have the client use only her right hand to perform the dressing activity to force her to only use the affected extremities, similar to constraint-induced movement therapy. The second task could be upgraded by having the client answer home program questions by only being allowed to read the flashcards once before they are then taken away, and she must answer the questions based off of memory alone. I could downgrade the first activity by allowing the client to use adaptive equipment with the right hand, such as a button hook, to reduce the amount of fine motor coordination required. The second task could be downgraded by having flashcards also contain visual aids to help further describe the activity and give her examples of it. The first intervention uses the biomechanical frame of reference, and the second intervention uses cognitive behavioral therapy frame of reference. And lastly, the first intervention falls under the establish/restore section, and this is because we were trying to restore the functional use of the right hand. And then the second intervention falls into create promote, because we are trying to promote healthy, or like the home program, understanding. Moving on for potential for improvement. Client shows moderate potential for improvement. Reason is moderate because their motivation limits her, and she is currently not motivated in performing her therapeutic exercises at home. And if this was improved, she would be at a good or high potential for improvement. Frequency for therapy should be twice a week for 8 weeks, and duration should be for 60 minutes each time. My discharge recommendation is she should be discharged when her right upper extremity range of motion progresses to within functional limits, and client can also complete her ADL and IADL tasks independently while also using her right upper extremity and not only using her left. Signature, Chris Best, OTS, and just the date. The occupational profile of the patient. Client is 31 years old and developmental level of adult. Diagnosis is a flexor tendon or laceration repair. Precautions in this case are heavy lifting, repetitive hand movements, awkward postures of the wrist, and the use of right hand on activities. Her relevant behavioral history is depression, because this is leading to lack of motivation therapy. Client is seeking services. She wants to regain use of a full right hand so that she, quote, won't look like a freak. Looking at the occupational profile itself, client lives in a house with her mother and father. Client and family are Roman Catholic, which caused friction with fiance who is Jewish. Client works as a bookkeeper for her father's furniture business. Violet does not attend school or volunteer, and prior to this incident, she had been independent in all ADL and IADL activities. She is currently able to independently perform all activities she had been performing before the incident, except for driving, working, and cooking. The reason she is unable to perform cooking is due to disinterest, not due to physical limitations. Client noted that she was only using her left hand to perform all activities, and that she does activities slowly to be able to perform them as taught by nurse assistants. The client's goals are to regain full use of her right hand, so she is able to perform two-handed activities again, as well as so she won't, quote, look like a freak.